Thank you for being here and participating in our third and final town hall for this year, fiscal year 2018. We know that you're busy taking care of our wonderful veterans here in the VA Pacific Islands healthcare system. So we thank you for taking the time out to share some of your day with us. Normally I start out with a joke, so this one's gonna be really funny. You guys ever wonder how Dr. Dubs always stays so calm?
Yes.
He has lots and lots of patience. Okay, so without further ado, I will bring our great director up, Ms. Jennifer S. Gutowski.
Thank you so much, Aaron. Aloha. Aloha. So good to see everyone. I have lots to fill you in on. Lots of great things happening here. I want to start off today with just some introductions. We have some new staff that are joining us. I want to make sure that you have an opportunity to hear their names and hopefully see them in the audience, or when you see them in the hallways, give them a high five and welcome them to our ohana. First I want to mention Lisa Asato, who's our new administrative officer to the Deputy Chief of Staff. Welcome, Lisa. We have Rochelle Sabold, who is our new Assistant Human Resources Officer, and I know that she's not present with us right now because she is down at the Kehi Lagoon working with homeless veterans and getting them jobs to come work here. So welcome to Rochelle. But we do have here also Raymond Madrid. Ray, you want to say hello? Ray is our new Chief of Prosthetics. So we're so excited to have him on board. Why don't you come on up?
Welcome aboard, Ray. Welcome aboard.
Ray, we're so excited. Tell us a little bit about yourself.
So apparently you're very excited because you gave me a mic. So I am local. I was raised here and graduated from Wanalua. I did 15 years in the Air Force, a year in the FDA, and 5 years now in the VA. And happy to be here, have dogs. I do like to run, so you may see me in the morning. Please do not hit me. And that's about a nutshell of what I can do, and I look forward to working with everyone. So.
Thank you, Ray. Also want to congratulate Michael Jackson, who has moved to a new position. He's now the Deputy Chief for Health Administration Services, so congratulations, Michael. Wanted to talk a little bit about, I had a handout and we'll be sending this to everyone online as well. What I want to pass out to you is what I call the cheat sheet for the VA Mission Act. And it's kind of called a placemat, but it really goes over very succinctly some of the key elements that are going to be up and coming in the Mission Act. They talk a little bit about community care, what's going to be happening there, caregivers program and how that's going to be expanding. They talk a bit about asset and infrastructure. They talk about the importance of recruitment and retaining our staff and information sharing. So I'll pass that out to everyone. Take a look at that. If you have further questions, more regulations will be coming out to us as the VA digests this act and puts it into policy. And as they pass it down, we'll continue to keep all of you in the loop on how that unfolds. So good stuff coming from the VA Mission Act. Also want to mention just a number of topics to update all of you. We do have a new network director that is going to be starting at the end of October. His name is Mr. John Brendecker. He's coming from Virginia. I haven't had it yet the chance to meet him personally, but I will be at the end of October, so very much looking forward to that. I will be certainly inviting him out to come see us so that we can show him all the good work that's being done here. Also, hopefully some of you got a chance to see Secretary Wilkie's town hall yesterday. But for those that haven't, let me give you my Reader's Digest version of his top priorities so you can be aware of what Secretary Wilkie has up on his priority list. Number one is customer service. That is his number one priority for the whole VA. The second is implementation of the Mission Act and seeing that come through fruition. The third is implementation of the electronic health record. Coming up in November, I'll just share with you that the senior leadership team is invited to a presentation by Cerner that's going to be highlighting a little bit about what the health record is going to look like and a little bit about our timeline. So I'll be sharing much more with you after that meeting in November. And his fourth goal is transforming businesses. And that's in the lines of finance, human resources, logistics. So the business side of our house, he's looking to really do some transformation in those areas. So super exciting. Those are the priorities from Secretary Wilkie. Want to also talk about a few things that are happening here. How many folks are enjoying the extra guards at the gate? Right? Yeah, good. So let me tell you about that a little bit. I meet often with the commander at Tripler, and we also would like to maintain that level of ease at the gate. However, I need everybody's help in doing that. And by that I mean, if we find that people are parking illegally in patient spots, in inappropriate spots, those guards that we enjoy at that gate are going to be pulled and will be deployed to giving citations. And we'll be back to the same situation at the gate before with long lines. So help me spread the word about the importance. At Tripler, Commander Krager, she is also conveying the same thing to her folks. So it's the same message, both to VA staff as well as to Tripler staff. That is an important that we try as much as we can to leave the front spaces. And there's a lot of work that Tyler and the team at Tripler is looking at. They're re-looking at a lot of our reserve spaces. They're re-looking at how we're utilizing the Tripler trolley. Lots of different things are going to be coming forward, but help all of us make sure that you're parking in the right location, because I don't want to see those guards deployed to doing citations.
Hello.
So the other topics I just want to briefly go over is, again, with the new recruitment for Steven Schneider in HR and Rochelle Sebold, I want to share with you that recently we're doing something totally different. We're doing job fairs. And we had two recently, and I don't have exactly all the statistics right off the top of my head, but I will share with you, I know that at a minimum, at that the job fairs, they had 16 on-the-spot job offers. So we have one coming up. We have a job fair coming up October 11th at the Oahu Vet Center over there in Foster Village. Tell a friend. We are hiring many positions, and we're looking at as much as we can to bring folks on board. At that recent job fair, we had nurses, we had MSAs, we had all types of positions of folks that are looking for employment from us. So again, please get the word out, and if you are interested in being one of the hiring managers to be there to do interviews on the spot, please contact HR to get on that list. It's an excellent opportunity. Also want to talk a little bit about all the efforts that are going on for access. Access to care is a top priority for VHA that we continue to work on. And with that, there's been a lot of efforts by the clinical staff here to really, and with HAS, to come together to work on what we can do to increase access. I want to give a big kudos out to Guam. Guam, over the past month, I don't know if folks realize how hard they've been working, but back in January, they had a wait time of 101 days. The most recent data I saw, they were down to 17 days. Right on. The areas that we're really putting some focus on now is here on the island of Oahu, both with Leeward and with our ACC here. And so we want to look at what we can do to make sure we have appropriate staffing, that we're looking at sharing space. Thanks to the C&P folks, we're sharing some space so we can spread out a little bit with Dr. Sakai's clinic. I'm also looking at some other initiatives that we can do. So we're recruiting some additional practitioners to come on board. New PAC teams are coming on board, as well as many thanks to the primary care teams, as many of the providers and teams have agreed to see new patients. So thank you all for your continued efforts to be able to help us see patients timely. I really appreciate that. And in that line, I also want to mention the importance of consults and how important it is that we look at consults and making sure that we're doing those timely, because it's important for the care of the veteran, right? If you need to be seen in cardiology, you don't want to wait for that appointment, right? You want it to happen as soon as possible because you're probably nervous about what's going on. So it's important that for when you get a consult that we attempt to schedule it within 2 days and put those comments into the system. And it's important that if it's a stat consult, pick up the phone. Contact that service that you're calling stat. Okay, it's really important. And for prosthetics, I know that from their system, there's actually no technical thing as a stat consult. Ray, what direction should I tell people about prosthetics? Do you have a, here, hold on, let me put you on the spot, but I'm gonna put you on the spot.
So it's the same way, if you need, please contact me. I don't have a government cell phone yet, but contact me until you get a hold of me. I'll also inform my PSA program staff assistant so she can try and get a hold of me. Once we get your info, we'll try and take care of you as much as possible, but please try and get a hold of me. I'll update my signature block once I get the smartphone, and contact me anytime and I will get that done for you.
Thank you, Benny. Okay, also want to mention, let's see, the Ambulatory Care Center here in the main lobby. Oftentimes we have events there as well as music and other activities. I want to let you know that we will likely be doing a little stand down on that. We've been receiving a lot of complaints about the level of noise generated from those activities, and I know they're a lot of fun. So we're going to have to work on that, and we're probably going to get a team of folks together to help us look at what we can be doing. Because even though with the best intentions and we're having fun, it's actually impacting those that need to do work and veterans that need to communicate with folks that are kind of on the outskirts. The acoustics isn't as good as we would like to see. So bear with us, you'll probably see some guidance on that coming forward, but know that it's not that we want to be meanies and stop all the great fun. We actually just want to do it in an environment that we can still conduct business and do it in a way that is respectful for everyone. So I want to also take a moment. This is one of the fun things that is just a highlight of my job. And there is a new electronic system that tracks both complaints and compliments that are coming in real time from veterans. And this is some of the things that they're seeing. And I can actually see this scroll live on my screen. It's so cool. And so I want to share with you some of the things that are happening. You can see some of the comments. We've already received over 1,100 comments just since July. And 65% of them were compliments. That is awesome. So here are some things that veterans are saying. My experience with VA pharmacy has been superb. The system works, and I remain healthy because of the diligence by employees to assist veterans in need. Keep up the good work. I was treated with respect and sincere concern for my well-being regarding follow-ups on medications, need for blood tests, and if any problems with any medications I may be having. The agents were always open to listening and hearing any concerns I was having. If I ever felt upset, they would try to answer me in a way that ensured my being heard and solutions can be found. I did not expect that. You just exceeded that person's expectations. Here's some other things. Thank you, Dr. Nelson, Nurse Sherry, and office staff. I always receive excellent care when I go in for my checkup. I'm always updated on my health, shots, counseling when needed, and follow-up appointments. I appreciate the time and patience taken to answer all my questions. Mahalo. That's for the Kona CDOC. So kudos out to Kona. The staff at the VA Leeward side are always courteous and very respectful. From the security, to the front desk, to the nurses who take our vital signs, and most especially to Dr. Curtis Nakatsu. Dr. Nakatsu is always concerned about my well-being. He ensures that my lab exams are current and ensures that I have everything I need day to day. Aloha, I've never before had better care than I currently see from Module 3. Leilani is ACC, and Dr. Sakai is the Queen of Spades. I love reading these. They are both extremely fast, thoughtful, and compassionate, have a sense of humility and humor, are completely professional. Quite frankly, I love them, and most all of the VA staff. I mean, yeah, isn't this wonderful? I mean, people are taking time to write these in. To share the good work that's being done. I just, so awesome. Let's see. I very much appreciate the helpful and friendly nature of the front office staff, Mr. Tuatasi and the gang. My primary care doctor is very helpful and very thorough at my checkup. Physical therapy personnel also very awesome, and that's out in Samoa. Let's see, let's do one more. Slow reading these. Let's see, I noticed a big difference since I last visited the Guam VA clinic. Now there's a machine if you're inquiring for information or for your appointment. I gotta tell you about that machine, hold on. So that is great. The staff there are really nice and professional in responding to my needs, such as follow up on my lab work since my appointment is within a week. My primary care doctor, Dr. P, is just great. So that's Guam, CBOC. You know, it's really amazing when you hear these comments and all the good work that's being done. You know, the one gentleman mentioned the little box, the kiosk that you all see as we check in. Well, I want to mention a little bit of the importance about the kiosk and the importance of MSAs in the check-in process. The past 2 weeks we had a trainer in here, a national trainer, to help work with the MSA staff on VetLink and the kiosk system and insurance capture. Our insurance capture rate for this facility was at an 8%. The goal is well over 90%. Why is this important? Because if we're timely capturing of insurance, then we're timely and correctly billing veterans for third-party insurance, and third-party insurance revenue comes back to us that I can use for medical services. That means I can use it for staff, I can use it for equipment, I can use it for things that we need here at this facility. So it is so important that we help support that check-in process, because doing it appropriately up front allows us and allows the MSAs to get all the information they need from the veterans so that we can be sure that we're doing everything timely and making sure that we're getting the revenue that we should be getting as a facility. And that way we can give back more to take care of our veterans. So when you see an MSA, high five them, ask them how the kiosk and VetLink is going, because they've been super trained over the past 2 weeks. And it was reported to me today that we're already at 27%. So we're already moving forward. So great work and kudos to the HAS staff. So one last comment, and then I'll turn over the meeting. I get so excited. There's upcoming Leadership Development Institute is going to be opening up today, and this is for Title V, GS 11 through 14, Title 38 physicians, Nurse 2 and above, and wage grade WGG 12 and above, WL 10 and above, and WS 6 and above. This is kind of at the network level leadership program that they're starting again, and we're really excited to see that. If you have questions about leadership development programs, Lynn Dubs is your point of contact on that. So just want to mention that's out and about. Please, I encourage all of you to apply for that program for those that are eligible. With that, thank you so much for what you do. I'm going to turn things over back to Haywood.
Thank you. So next we'll bring up Jason Gonzalez, who will share some details about On the Moment. But before you do that, how do you make a waterbed more bouncy? You add spring water.
How's everybody doing this afternoon? Jason Gonzalez. I am one of the program managers for On the Moment, as well as Jim Tashira. And we're going to show a brief clip here that we do show in On the Moment, and then we'll go ahead and talk about the program afterwards. So we're going to pause that, let it buffer through. I'll talk about the program real quick, and then hopefully by the time it comes back up, good to go. So what is On the Moment? On the Moment is a Veterans Customer Experience workshop about delivering high quality veteran customer service the VA way. Okay, and the VA way is obviously we have the I Care values, but we're introducing 2 more values to that, which is We Care and the Salute Recovery model. All right, we use 3 guiding principles, which is effectiveness, which is understand and respond to needs, ease, which is guide the journey for the veterans, and emotion, which is connecting and caring. Currently, we're offering it every other week, so it's on Neo Tuesdays, in the EOC conference room on the 4th floor in the E-wing, from 8 in the morning till 11. What I do want to put out is, please, highly encourage your people to sign up. You can do that through the newsletter that comes out every single Monday. There's a link, it's very easy to sign up. If some of you want to have a private workshop for your service, please let me know, and I will facilitate that for your service in case you cannot send people all at once. I can come down, we can go ahead and get that taken care of so we can get as many people trained up on this program as possible. It's a really good program. I believe it'll open your eyes up to a lot of ways that we interact every day with our veterans, and I really stand by this program. So hopefully we're ready to go.
Jason,
Yes, ma'am.
just remind people that it's good for 3 professional education.
That's right. You get 3 CEUs for that as well. If you qualify for those, you get that as well. It's a 3-hour workshop, and again, every other Tuesday, so every Neo Tuesday, 4th floor, 8 to 11. And then if you want me to do a personal one, just contact me and or Jemery, and they'll get hold of me, and we'll go ahead and do a personal one for you guys to surface and come down and take care of that. Thank you. Grab veterans and basically put them on the spot to talk about this. And that last lady that you saw there when she said, "I own the moment," that wasn't scripted. But you saw it kind of break at the end, she had a smile, and she's like, "I own the moment." They kind of told her what this was all about. So again, please come and support the program, send your people to the program. We've got about 150 or so, we have 159 trained at this point, the workshop. I'm telling you right now, it's a great customer service model to take care of our veterans. And a simple smile and a simple thank you for your service goes a long way. Thank you.
Thank you, Jason. Thank you very much. So remember, bottom line up front, sign up for Own the Moment. So me, myself, I started out with nothing, and I still have most of it. So with that, we'll bring up Ms. Marcy Newman, who will speak to us about the flu campaign.
Everybody, I think I've met a lot of you, maybe not all of you. So first of all, who knows that the flu vaccine is here? So the rest of you didn't know. Okay, next week, Monday through Friday, 9 in the morning. I want to speak without this. Oh, I need to. Sorry. 9 in the morning till 11 in the morning, ACC first floor. There's going to be a flu campaign kickoff. Okay. Unfortunately, I won't be here Monday through Wednesday, but I have it covered every day. So employees and veterans, but we really want to capture all of you. Know that there is the directive, 1192 is still in effect. So if you decline an immunization and you deal with patients, you have to wear a mask till March 30th. So that is in effect. It's up to each of the supervisors or managers if they want to do any kind of punitive actions. I hate to even think that, but I do need to say that that is part of the directive. So look out. Please come to ACC next week. If you can't get into the clinic, Employee Health can always see you. And after next week, of course, we're open to giving you immunizations as well. If you want any of us to come as a visiting flu troop to your unit or department, please let us know that as well. So that's what I had to say. And it's quadrivalent, mercury-free. There are egg-free available if you need it. Anyone listening from the C-Box and anyone that needs to reserve the flu vaccine, you need to contact pharmacy and let them know how many. Okay? Next thing, everyone put down your papers. And if you're listening, put down your papers. Okay, so we're going to do a little mindfulness exercise. The reason why I'm talking about whole health, in addition to health promotion, disease prevention, program manager, I'm helping lead the effort of rolling out this program. Raise your hand if you know anything about whole health. Okay, so we have a lot of you. Raise your hand if you know nothing about whole health. Okay. So we're going to get everyone on board. I'm going to help facilitate that. I did this at the Fresno VA. I helped roll out their program there as well. I'm also an acupuncturist, just so you know I have that background. So I have a healing arts background. I'm very, very passionate about this program. And I want everyone to close your eyes. Take a nice, slow, deep breath. Put one hand over your heart. Put one hand over your belly. As you're breathing, you breathe in, push your belly out like a big balloon. Nice breath. Hold it at the top. Exhale slowly. Breathe in again. Hold it at the top. Exhale. Curl your lips upward and smile. And say, ah. Okay, good. Open your eyes. That is a squeegee breath. So that there are many different kinds of mindfulness breathing techniques that you can do. I recently went to a healthcare summit 2 Saturdays ago. I've been to a lot of mindfulness training and deep breathing and healing arts techniques. So I've never seen this squeegee breath called squeegee. So it means you're letting it all out. The stress is out, it's done. Then you're embracing, you're smiling, and again, you want to pick a time during the day that something triggers you, whether you turn off your car and you sit in there as you arrive at work, you do a squeegee breath to get you in line with going in calmer. You're going to think better. You're going to feel happier. Okay? I wanted to start with that. Now this is the whole health wheel. This is all about not just putting a veteran in the middle. This is about putting each and every one of you right in the middle where it says mindful me awareness. It is about employees actually embracing whole health, and I'm going to explain what it is. I know I have a time limit. I wish I had an hour, but I don't. So the outer part of the circle is community. Community means who can you reach out to as partners that you can get complementary integrative health or even other services that you might not be able to get here at the VA if you're a veteran as well. Thank you for your service for all of you veterans. Or if you're out in the community wherever you seek your care. So the next circle inward is prevention and treatment. So it's important to think there are many ways of healing. Conventional medicine is so important, and we obviously have to embrace that. but I'm hoping each and every one of you is curious and maybe has an openness to seeking other complementary integrative. It's no longer called complementary or CAM. It used to be called alternative medicine. It is no longer that. We all work together. So if someone has pain and they need some kind of pain medication, you're working in conjunction with your regular doctor to get acupuncture, chiropractic, yoga, tai chi, all these healing arts techniques. So the inner circle is actually 8 components of health and well-being. Each one of them are self-care components. So I want you to raise your hand if working your body, working out drives you. You love it. Raise your hand if you love working out. Okay, I'm gonna change that. That's good. I like everyone raising their hand. I raise my hand at all of these. Anyway, so surroundings. Raise your hand if walking into a room, there's a waterfall, the walls are light green, blue, you feel so calm, peaceful, you love surroundings and how it heals you. Raise your hand if that's important to you. Okay. Raise your hand if you love to learn a new skill. Gardening, language, get a new degree. Raise your hand if that speaks to you. Awesome, good. So raise your hand if you're thinking about dinner. Lunch. So often, and I know Cindy's sitting back there, often food is really important. I mean, obviously not just for sustenance, but we think about it and eating the right things to give you the right amount of energy and the healing. Sometimes that is really the thing for so many people. And it's very important for lowering inflammation as well. Raise your hand if you get at least 7 hours of sleep a night. Wow, okay. So did you know 25% of folks out there have insomnia? 25% is the latest. So we know through research, if you have insomnia, you're not going to heal the same. Your pain syndromes will be worse. You're going to have cardiovascular risk that is higher. You may be gaining weight because you have sleep issues. So sometimes that's important. And then think about rest and recharge, how you need to rest, recharge, and feel your best. Friends and coworkers, raise your hand if reaching out to a loved one is important to you. Good. Raise your hand if higher spirit calling is important to you. And last, raise your hand if thinking about how you can help heal yourself through biofeedback, yoga, meditation. Okay, so stay tuned. There is more to come. I really appreciate everyone's participation, and I'm hoping you invite me to speak at your meetings. I didn't have enough time, but I'm so gracious that you allowed me to speak. Thank you.
Thank you, Ms. Marcy Newman, and we thank you for helping us to improve our whole health. We look forward to that. So without further ado, I bring you Mr. Wilford Lee, who will speak with us about the all-employee survey.
Okay, so you guys remember the all-employee survey you guys did in July, right? Well, on August 20th, the results did come out, and so the all-employee survey task force has been working on compiling that data. Just incidentally, there are 11 members to the all-employee survey AES task force, and we meet weekly to discuss our plans. So, if you look at the top here of the screen in this teal-colored bar, you'll notice that there are 836 responses. So that's how much we collected this year. We sent out 1,125 surveys out to the Pacific Islands healthcare system. 836 responded, and so that yields a 74% rate. And so that compared to the VISN, just in case you're interested and competitive, the VISN was at 63.9%. Our goal was 70%, so we actually exceeded that by 4%. and then we beat the visit. And for the VHA at large was 63.1%. If you guys also remember the action planning priorities, the survey asked you guys to identify which were your priorities. And so this year, for 2018, we identified communication, workload, and growth. And this is actually identical to last year's last year's priorities as well. Okay. Can we go to the other slide, please? Okay, so the AES, we compiled it, or it breaks down into quantitative and qualitative data. So this is the quantitative data. Since August 20th, we've worked very hard in trying to make this very user-friendly. So there are going to be roll-up groups, which will be larger groups, and then there'll be individual work groups as well. There's about 80-something work groups that we pulled all this data into. And so you guys will be seeing that as it rolls out. So this is kind of the first time it's really been given out to or shown to everyone. We've organized it in a way so that the scores go from highest to lowest. And so this one is actually for the entire facility here. And so if you also notice that there are going to be greens here and some yellows. So there's 66 questions that came with the all-employee survey. 31 of them were carried over from last year. So they actually kind of did a revamp of the all-employee survey. So only 31 of the questions got carried over. It was the all-employee survey was also combined with the federal employee survey, including the best place to work survey as well. And so out of the 33, I said, right? I'm sorry, 31 repeat questions, you'll see that there are 27 of the questions are green. And green is actually a really good thing, because that means we are trending up in that. So it's actually creeping up. And so you'll see 27 out of the 30 questions have gone green. And then the best place to work, I think if you scroll down, please. Yes, here. The best place to work, so the good news is that we've actually gone up to 55.26%. So that actually is a 3.54 increase. So that's actually pretty significant to us. And if you go down a little bit more. Oh, no, I'm sorry, go back up. Oh, here, right here, okay. And then also for this, the sharing of the AES and the use of the AES has actually gone up pretty significantly as well. So that we're actually really proud of that, given what we've been doing in the task force. So at this point, the quantitative data is going to be published, and so we are meeting in a couple weeks and in the next couple of weeks and trying to figure out how we're actually going to be rolling that data out to everyone for consumption. As for the qualitative data, we're working on that right now. The qualitative data is where the comment section, where you guys actually wrote out your comments. So we have Dr. Jordan and Dr. Kaminte who will be working on compiling that data, and we'll be presenting that to the director at the end of the month, if I remember correctly. And after that, we'll be rolling that out to all of you guys as well. Okay. There will be supervisor training on doing action plans as well. And Dr. Judy Carlson is working on the dates for that, so you guys she'll help you guys come up, or at least give you suggestions and how to do your action plans for this year. And in the future, as we start rolling out this data, the quantitative and the qualitative data, your supervisors will be working with you guys in the work groups on how to try to improve the scores for next year. So I think that's all I have for the on-employee survey task force. And so that's kind of what we've been working on for the last couple of months. So I really appreciate all of you guys for doing the on-employee survey and we hope that you'll continue doing that and giving us your feedback to us. Thank you. Thanks for reminding me. So again, we have 11 members on the employee survey task force. We meet weekly, so we're always open to having new blood, giving us new ideas and new suggestions, and helping us out. So if you guys have more, please contact me, Wilfred Lee, and I can go ahead and include you on the emails and invite you to the meetings, please. Thank you.
Thank you, sir. So the last part of our town hall for today will be left for Q&A. So you get to ask the pen tab anything you want. So we're going to start with the questions that were emailed in, Andy? Okay, so the first question, are we moving to VSE? It still has a lot of bugs, and I believe Mr. Michael Jackson will answer that question.
Fantastic. Nationally, yes, we have to migrate from Vista to the VSC GUI interface. In reference to the question, so think of, let me see this for a second. How many of you actually use Windows? Okay, so we pretty much use Windows. So when the VSC was rolled out nationally, there were some bugs, unfortunately. So as those bugs are identified, patches are rolled out to mitigate those bugs. However, we know when it comes to software, there could be additional bugs. The good news is, at HAS, we have a staff member that on a weekly basis calls into the national VSE call, where nationally it's discussed throughout the whole VA on bugs that are discovered and when they're going to release patches to mitigate that identified bug to the software. If you all experience something that hasn't been identified, please make sure to let us know in HAS, and our point of contact is Candy Larson, or you can send it to myself and I'll make sure that the national is alerted to that bug and they'll look into it, and if necessary, and when necessary, they'll go patch to mitigate that. Okay, so the bottom line is we have to use the Vista interface GUI. We have to use it. Okay? Thank you.
Thank you. But if you have that many bugs, why don't you just use bug screen? So our next question. Is choice going to continue to be something that the VA offers patients? And we'll ask Ms. April Seghorn to answer that question.
Okay, so as of right now, choice actually ends on June the 6th, I think, of this upcoming year. There may be another program that replaces it, but the funding at this point in the choice program will disappear come June. I didn't say Try West now, I said choice. That was the question.
You know, April, I would clarify a little bit also. So yes, technically that will end, but we will continue as an organization to do care in the community and care coordination. It'll just have another name or whatever, I don't know what the new nomenclature will be, but we'll still continue to do care in the community. It'll just be under the VA Mission Act now. So it'll become that new program from that perspective. And Tri-West did have their contract extended. They will be working with us for April, what's it, up to 2 years?
Well, we haven't got the extension yet.
So I guess it's a work in progress that they're working on that. But I will say that what's happening across the country is that the VA is kind of dividing up in regions, what they're calling community care networks. We are part of Region 4. However, see footnote, not all of our health system will be part of Region 4. Hawaii will be part of Region 4, but my neighbor islands are actually going to be something that we manage here completely on our own, which I'm looking forward to that leadership. And so what I've asked April to do is to work with us on putting together a business plan of what is that going to look like for us, looking out in the future forward. What do we need to do to build her department to be able to not only then meet the requirements for the community care network of Region 4, but also to take on the requirements for the whole process for our neighbor islands and how that's going to work. So a lot of things coming forward. Look forward to April and her team on how they will develop that going forward.
Okay, I just want to clarify.
Yeah, go ahead.
So neighboring islands, Guam, American Samoa, and CNMI, not the Hawaiian neighboring islands, okay?
Thank you.
And also, just so you guys know, we, as Care in the Community, have not sent any patients through choice, all this FY. They could use choice 40, but we've been using PC3 through TriWest. And it's not for you guys to know the difference, I'm just letting you know. So if it did leave tomorrow, we still have our mechanism that we use today the same way.
Thank you, Ms. April. Ms. Jennifer? And by the way, choice 40 is for veterans to self-refer. So they can call TriWest and refer themselves. Okay, question 3. Is the Windward CBOC going to be a reality? And if so, when?
Yes. Yes, we are moving forward with the Windward community-based outpatient clinic. I think the latest status I have is we had a market survey that was conducted in June, and the request for the lease proposal is out. So what I'm hearing is that there is interest in the community for this clinic to be located out on the Windward side. I am very hopeful that things will continue forward. Of course, you know how things go, but that is our intent. When? I can't pin that down yet because there is quite a process for that, but if I was a best guesser, I'm thinking sometime 2019, but again, don't hold me to it because I don't have my facilities person here to probably correct me in terms of that. I like to be optimistic. But the idea also behind Windward is that it'll give us a clinic to be a prototype for the new Aloha Center. So the idea is to really design it and hopefully see it come through PACT design so that we are hopefully hopeful to be able to kind of see how that's going to fit for the new Aloha Center. So we're pretty excited about the opportunity and we'll continue to keep you posted about that.
Thank you. Question 4. Can anything be done to improve parking for patients at the clinic?
So we talked a little bit about that before. So again, just all of us be mindful of parking in the correct parking spots. Feel free to encourage others when you see them parking in the wrong spots. You know, we want to encourage people parking in the correct spots. Our facilities team is working again closely with Tripler, and they're looking at the campus, looking at what we can do. What I hear, rumor has it, that there's some lots that are up in the further part of the campus, up near the hotel, et cetera, that remain unused or not fully utilized. So both Tripler and us are looking at what can we do to maybe ensure that, so instead of people parking on grass, that they're parking in actual parking spots. So more to come on that. That's definitely an area that we know is important for our patients and our employees.
Thank you. Next question. Are there any ways to increase transparency in the RAB and hiring processes?
So the REB, for those that aren't familiar, that's our Resource Executive Board, and absolutely. So with Chandra Lake coming on board as our new Associate Director, as well as our new HRO, they're certainly going to be taking a look at that process. And it should be very transparent to all of you in terms of the decisions that we're making and why we're making them. You heard me just give a little preview about what's, hearing a proposal from April about how to build up care in the community staff. It should be no secret of what we're doing in terms of our priorities for hiring and communicating that to all of you. So I would say more to come on that as well as we move forward. And Chandra, I don't know if you want to add anything to that.
I think the only add I would have, Jennifer, would be maybe the discussion about our committee restructure, our governance restructure.
Oh, thank you.
And how there'll be a resource council that the items within resources will report up through. And we haven't fully developed all of that yet. I'm sure it's to be rolled out here shortly with the new fiscal year. There'll likely be a shift, so to speak, in Resource Executive Board from the standpoint, we'll probably have more of a physician management committee, we'll have an equipment committee, space committee, and the resources they're having. Some of these things do exist, but some of those will be a one-off from where we're at now to more pointedly look at some of these items and to make clear paths on how we get to delivering some of these resources to the point of service. So more to follow.
Thank you, ladies. And last question, last written question, can leadership share information regarding justification for aligning the MSAs under HAS?
So yeah, so let me share a couple things with you of why it's was important and continues to be important that we have scheduling aligned under HAS. Some of you may not realize that some of our scheduling practices weren't necessarily as accurate as they could be. And that's not saying people are trying to do things wrong. Just that when it comes to scheduling, it really is an art of knowing all the technical components, and those in HAS have that. And I'm not saying that nursing can't be good at it or anything, but I'd love for nurses to be nurses, you know, and doctors to be doctors. And part of that move was to really have a conscious decision to have the subject matter experts be working with those folks that are going to be doing the scheduling. And so a lot of improvement has happened with scheduling accuracy since that move has happened. And I know that there are growing pains with that, and we're working through that. And there's a lot of efforts from Andrew and his leadership team and from the whole facility to make sure that we're doing a better job of hiring, getting people on board, right? I know those are big issues. So, you know, there's been a tremendous improvement in terms of how we're doing, like I said, scheduling accuracy. We've definitely gone up to over 90%. We've done a greater job with recall reminders. We're doing a better job with consults. We still have some ways to go, but I mean, this is a very specialized effort that has to be done, and we want the administrative folks to be doing that, and I would like the clinical folks to be doing clinical. So it's a journey. I know it's not perfect at this time, but we're continuing to hear. In fact, we're going through some of our management briefings. I have a presentation tomorrow from primary care, and I know that HAS and other departments work together on that because they want to share with me where there's some opportunities to make sure that we're building the best PAC teams that we can. Because as you heard, as I said, VA Secretary Wilkie wants customer service, you know, so part of it is making sure we're providing the best customer service and doing that in a team-oriented way with the right people doing the right skill sets. So I'm sorry, it won't be changing at this point in time. We're going to continue to keep it the way it is, but we are committed to making sure that it's the very best, and we'll continue to work on that transition. So thank you very much for the very honest question.
Thank you. So we have time for maybe one or two questions. It's your time, your guys' turn. Question.
This question about the Aloha Center on the leeward side, is that going to be a reality? And am I hearing you say that the windward now has first priority and nothing will happen with Aloha until windward is a reality?
No, that's not correct. But the timeline for Aloha is much further out in the future than the windward at this point in time. The Aloha is at what's called a major lease, and I am hoping that they will do the award for that this first part of the fiscal year. Now, this is not in my control here locally, so I'm relying upon Office of Real Property, et cetera, to do some of these movements up in DC. So once that gets rewarded, then there'll be a kind of a couple year out process for the major lease. I can definitely produce a timeline for all that, because we have multiple leases that are going to be coming on board over the next couple fiscal years. I can share that with everyone in an upcoming employee newsletter article. So look for my message in the upcoming employee newsletter article. I will give an update on where all the projects are and what the timelines are. Aloha is still moving forward. I'm just waiting for central office to hopefully do the award beginning of this fiscal year. So that's what I'm hoping for, and we'll continue to keep you posted on timelines. Chandra, I don't know if there's anything you want to add from a...
I think the only thing I'd add is it's looking good from the standpoint, there was another lease in our network that was stuck in the same place as Aloha, and it has recently been awarded. That was announced today at ELF, so that's the Executive Leadership Forum for Vision 21. So that movement alone on that project, and it was a little less complicated than ours, lends a lot of hope. And hope's not a strategy, but it shows that some of the barriers we've met in the past necessarily won't be an issue here because they've been removed. So I do anticipate with Jennifer that this is going to happen.
Thank you very much. So that ends our town hall for today. We thank leadership for participating, and we thank you as well for participating. Last time I left you with Maya Angelou quote. Today I leave you with Dr. Seuss. You are you. That is truer than true. And there is no one alive more youer than you. Thank you.